Good afternoon. My name is Loren Robinson. I'm here as part of the Robert Wood Johnson Foundation video podcast series. We're delighted to have Dr. Joshua Sharfstein with us today, who is Secretary of Health and Mental Hygiene for the state of Maryland. Good afternoon.
Good afternoon.
You spoke a little bit earlier about school health, and when I think about the health of school-age children, how important that is, a very small part of that is done in the pediatrician's office. And it seems like school health is really where we can make a difference. And you spoke a little bit about a hospital that has kind of assumed control or kind of agency in this moving school health forward. I wonder if you could speak a little bit about that.
In Maryland, I was telling the story of one hospital which has a different kind of financial incentive because they're on a global budget. So if there are fewer admissions or emergency room visits, that helps their bottom line rather than hurts their bottom line.
Right.
And this hospital, Meritus Health in Hagerstown, took over the school health program, hired all the nurses, and they did that in part because they felt like it would be an economic winner for them. Not so much they were going to make money on the school health program, but if they did it well, even if they broke even on the school health program and they helped kids with asthma control their asthma so they didn't need to go to the emergency room, they would save money on the emergency room visits. So every other hospital that's paid fee for service makes money on the emergency room visits.
Right.
But certain hospitals in Maryland on a global budget, they lose money on emergency room visits and suddenly they become a different kind of partner for community health, including school health.
Thinking more about kind of this global payment model, how have specialists and specialist societies kind of reacted? I could see from a primary care perspective this sounding like a great thing, but in kind of these fields that have been traditionally fee for service and kind of paid more on the volume or number of procedures, how has that reaction been?
I think that they're among the most nervous. I mean, frankly, somebody who's been doing extremely well on fee for service and that's their whole model is going to be nervous by any kind of change. You can understand that. And so some of my more difficult meetings have been with specialists who, are worried that their world is changing. The one thing I would say is that they realize their world is changing. It's not my decision for it to change. It's just the world is changing and that their Medicare rules are changing. So many different aspects of their professional lives are changing. But what I've found in talking to them is that there's enough of an understanding, at least among some in each specialist society, even ophthalmologists, that they will be thinking about how they can add value, and that ophthalmology associated with diabetic retinopathy and preventing blindness, and how can they be part of a medical home that is actually helping people with diabetes. So there's a lot of opportunities in this shifts, even for specialists, and I think that we're increasingly, I hope, see specialists jump in.
Dr. Sharfstein, thank you so much for speaking with me today, and we look forward to hearing great things continue to come out of Maryland.
Thank you.